So having precision and doing accurate measurements is very important in performing good otoplasty and creating symmetric and natural results. So we are marking on both sides symmetrically how we're going to be bringing the anti-helix closer or tighter, and also how we're going to pin the ball. So both reduction of the concha and anti-helical fold have been marked symmetrically on both sides. So now we are doing a post-auricular incision. We like to have the posterior marking 3 to 4 millimeter above the crease. And we are going through subcutaneous plane of dissection. Okay. In select cases, we're going to create a fishtail modification for the inferior aspect of the inferior pole, basically. Hold this, please. Great. Good. Okay. Okay. And you want to get the skin off. Sometimes if there's a tiny bit of ooze, we can buzz it, but usually I do this once all the dissection is done. So we're going to start from a superior to inferior direction. We're going to do a supraprecondylar dissection here. So elevation. So once we're good with the dissection, now we're gonna go one hook interior, one hook posterior. Gonna create maximum tension. We want to remove some of the post-auricular muscles. This removes the function of the muscle, so it weakens basically the muscle effect, post-auricular muscle effect. And the next step is we're gonna use silk stitch. This is a 3/0 silk to give us all the markings. Okay, go ahead. So we use this as markers. Go ahead and cut. You can use metal and blue for this step too. I find silk a little bit easier. So now we start inferiorly. Want to go all the way through, except getting the dermis on the other side. So my assistant's constantly checking on the other side, making sure we don't get any skin there. Same thing. Pull this through. Good. Good. Excellent. Now this one is going to be under tension. Go ahead and relax that. Let me see. Sometimes I like to just cinch it all the way. Good. All right, so we're going to go for number 2. I usually like to hold the ear in my hand. That gives me better tactile sensation. Going all the way through the cartilage on that side. Coming back, assistant will check. Make sure we're not in dermis. Good. Come back gently. I'm gonna hold it taut. And I'm using 3/0 Mercilin suture in this case. For ears that have strong and stiff cartilage, I use 3/0 Mercilin, which is permanent. The ones that are a little bit softer, for the mustardy part of the surgery, I use 4/0 Mercilin. Great. Let's go back. Let me see, relax something. Good, come back. visual and tactile cues for a little bit more tightening in that area. That's about it. Okay, show me again.
Okay.
Thank you. That's it. So we're done with our mustardy part of the antihelical fixation now. Again, we are repeating the same steps to expose the back part of the epicircular region and accomplish some hemostasis. Then we're going to come back once the mustardy sutures are done.
How you feeling?
A new man.
It's like you got a free workout too, huh?
Yeah, exactly.
You're like, I've done 15 sit-ups already.
Yeah. Pursuit of perfection.
Okay, so we are done now. We finished the furnace on the left side, so both ears are matching each other with pretty good symmetry. The keys, as you can see, we want to maintain a nice and natural contour, and superior pulse is slightly further out of the inferior pole in this case. I do not place any tense mid-pole furnace sutures. I think they create a natural look, so with just superior and inferior pole reduction, we get a great result. Alrighty, so we are 6 weeks out from our bilateral otoplasty procedure. Now most of the swelling has gone down, the scar is mostly contracted. This is pretty much the final result that we're seeing. And we can see great natural contour between both ears and very good symmetry between the two. The key elements of an otoplasty, we can go over it again. Let's review one of the ears here. So we wanted to create, in this case, we had two issues. One was antihelix that was not bent properly, or it was just too weak. The second part was the concha, which is here. It was too prominent. So what we did is, we did both techniques of creating a tighter bend in the antihelix here, and also pinning back the concha of the ear to get it closer to the head. So a combination of both techniques with proper sense of tightening, what area needs to be tighter, what area shouldn't be too tight, gives us this very natural and elegant result.
Are you happy?
Incredibly happy. It blew my mind, yeah.